Welcome to another power supply video series. I'm Justin Poulin. With me today, as always, Brian Bartel, Suzi Collins. We've had a pretty interesting run over the last 3 or 4 months. It's been pretty hectic, I'd say, and disruptive in the supply chain. And obviously, some things changing in Washington. And now all the talk is tariffs, except I don't know that anybody knows exactly what to anticipate. So, we're not here with all the answers today, that's for sure, but we certainly want to cover the topic and maybe some of the concerns that everybody is having and how we're navigating it. We're recording this in early February. It's probably not going to come out for a month or so, so lots will change in the meantime. But I think just talking through like the implications of tariffs and what that means for the healthcare supply chain is a great idea. And so Suzi, let's start with you. I mean, I know you've started in a new role recently. How prevalent is this conversation with where you sit kind of in a larger healthcare supply chain?
Yeah, definitely from an analytics perspective, there's a lot of interest in, quite honestly, understanding how will it impact healthcare and what is the country of origin on all of the products that we purchase. And that's a very large question, and it's a very broad question because there's manufacturers literally all over the world. Obviously, first and foremost, we all know Mexico, Canada, China. I think that it's really what are we going to be able to do from both the analytics perspective and getting good information, from our vendor partners so that we can understand the potential impact as this continues on.
Brian, how about you? I mean, you've probably been keeping a close watch, but are you sort of like the sole person in your organization that's keeping an eye on this? Are you having conversations with the C level? Like what's kind of just, what are you experiencing on a day-to-day basis as you sort of begin to evaluate the potential impact of tariffs?
Yeah, we've had a few conversations, and of course, the question is, well, what is this going to do to prices? A lot of that we push back to the GPO. So there's regulatory and government affairs that will put out some pretty good reports. So if you're a member of a GPO, I would definitely recommend reading those, reaching out, trying to figure out what it is that they anticipate, because again, they're kind of that first shield, if you will, to kind of help with those price protections.
Yeah, and I know ARM's doing a nice job of keeping an eye on things as well and advocating for the healthcare supply chain through this. I mean, I think one of the biggest questions is, obviously costs go up if tariffs are applied. It's just a direct relationship. The bigger concern, and I think the question is, who's going to bear the cost? Because obviously, healthcare supply chain's been under a lot of stress. Feel like those margins just keep getting tighter and tighter, and you know, at the same time if it gets passed on, do we see any change in reimbursements, from the payers or government funding to be able to help cover those costs? Because that's ultimately where it's going to go back is, for healthcare organizations to continue to be financially viable, they're going to need support with the rising costs from somewhere.
100%. And ARM just actually sent out the copy this morning of the letter sent by the AHA to President Trump, asking for the consideration that, potentially medical devices and products are excluded from the tariffs. Do we know if that's a possibility? We don't, but for the just the sheer amount of products, and not only the product themselves, but obviously the component part of it, right? Because it might be built and manufactured here in the States, but are the primary components, or let's say even the most expensive component, coming from somewhere else? So it's going to be that what's going to be the level of transparency that we have to understand, mitigate, or manage any type of price increases that might be coming from manufacturers.
Yeah, you're not just pulling the device all assembled in from another country per se. There's the cost of goods, and that comes into that. And so there's even, I think, a tracking struggle with that, honestly, is how would you qualify for that? I mean, it's a great recommendation. I think we have to remember that the healthcare supply chain sits as a very small piece, I would say, of this entire conversation. And so, I think that's great that the AHA has been advocating for some sort of relief for healthcare, given the financial situation that we're all in. At the same time, how much effort goes into trying to regulate that. And so, to your point, Susie, there may be, hey, it's, we might waive it for products that are coming in, but how do they really track cost of goods for medical device manufacturers that may be manufacturing in the US, but they very unlikely, especially when it comes to all the electronics and the smart devices that are coming in. A lot of that stuff is not being manufactured in the United States today. um, Brian, what do you think about, you know, that transparency piece, right? From the suppliers in the meantime to be communicating out. Is that pretty critical for your organization as you're kind of preparing? It's like, do you expect a certain amount of notification before prices do rise, uh, et cetera? Like, how do you navigate that?
Yeah, that's a good question, Justin. And I was on a national supply chain call with ARM yesterday with some of the really big IDNs, and it was really interesting to hear that very high level conversation that they're having. And somebody made the comment, I wish I could remember who it was, but they said, remember that somebody's profit is somebody else's cost, which pretty pretty basic. But again, it's something that's important to remember. And so what they were talking about is exactly that. We can weather some price increases. Things are already challenging from a financial landscape, but they were talking about implementing technology. One of the organizations was using just an off the shelf bot that used AI to comb through their invoices to look for anything that said tariff or anything related as far as like an upcharge or surcharge or any of that. So they're already trying to be more proactive, which is pretty cool. And the overall sentiment was just that what you're talking about, the unknown. What is it going to look like? The I think the biggest concern that was shared is this escalating into an all-out trade war, and that's what they said. There's going to be some significant challenges that we haven't seen for a while if that's where it actually escalates to. So again, from a price perspective, definitely concerned. But then, what is this really going to do when you start looking at everything that's imported and manufactured overseas?
I mean, obviously, Brian, you talked about, kind of the pressures and the things we've already been seeing. Inflation is one of those things that I think we've been impacted by over the last several years. And I remember we did an interview on power supply, I want to say 3 years ago, with a bunch of members from the University of Arkansas, and talking about, what they projected the impact of inflation to look like, and how would that also sort of, like, if you look at the cycle of when like payer contracts are negotiated, it's like every 3 years. And so if inflation like moves really quick, or we see these kinds of costs being passed on, we're not necessarily able to recoup the revenue for until those payer contracts come up again. Never mind the government funding. And I think that's a big factor. We did another interview and talked a lot about, with I think her name was Samantha Jones, about the shipping industry, and that the contract cycles in the shipping industry are typically, like, they can in some cases be month to month or every 3 months. And it makes me wonder, like, is that what would need to happen for us to be able to weather a storm around, potentially, it's a horrible word to say, but trade wars and inflation all combining at the same time? Would we see our contract cycles, having to be much shorter than they are today? And what kind of burden, either one of you can chime in on this, but what kind of contractual burden would that place on supply chain if we had literally that level of, change related to contract cycles?
It is really difficult because it's also the tracking of it. And in a perfect world, you get a bill in June and you pay the bill in June and you move on. It doesn't really happen that way in healthcare. So we also have to understand what was our pricing at the time that we either provided the PO to the vendor or, paid that invoice. So it makes it difficult when dates are changing. And we've seen, consistent price increases from a lot of different vendors in a lot of different parts of healthcare nearly every year, quite honestly, since COVID happened, where sometimes you went 2 or 3 years without a price change. So it's also that tracking mechanism of, did my price change? was it a valid change? Was it at the appropriate time? Does it, was it changed with the issuance of the PO or after it was invoiced? There's a lot of moving parts in kind of collecting that data and being able to ensure that you as an organization are paying things appropriately at the agreed upon cost. And when we're adding the complexity of price changes that could happen in 60, 90, 120 days, that just adds to the challenges.
I wonder, like, do you have any price protections around a certain percent increase in your agreements today? How do you navigate that? Like, if you were to push back, on suppliers coming to you and saying we have to increase our prices because of the tariffs, like, do you have protection language or anything like that that helps give you some runway to maybe negotiate through that?
I would say that's really dependent on the contract and the agreement. So I know that the GPO that I use, the actual terms and conditions are pretty tight. They don't share that, and so they'll start sending out emails about price increases or savings. Right, we see a lot of those as well. So that's kind of dependent on there. As far as local contracts, it's really going to be up to what you negotiated and what that contract language says. I do feel like if it does continue to escalate, there'll be more conversations around that. And what Suzi was talking about prior to, going back kind of retroactively looking at, well, what was the price, what the price should be, and all of that. But another big component of what was being discussed yesterday is how are you budgeting for this, right? So, Justin, to your point, usually we will budget some form of inflation. Some organizations have said that they did start putting in what they thought the tariffs might do, and then other ones were like, we don't want to do that. We're going to put that on the back end. We're going to track that on a separate mechanism, because they don't want departments to be like, oh, well, now I have X amount more dollars to spend if the tariffs don't come out, right? So it's a balancing act too. Even when you're looking at the future, it's like you have to budget correctly, but in this uncertain time, uh, it's very difficult to be accurate as well.
Yeah, it's interesting how they'll tackle that budgeting piece, it's because I think it's a really great concern, right? If you have the budget and you're making all of these commitments with, tariffs in mind, and then to your point, they don't have them, that doesn't mean that we're in a better financial position and we can spend that money. But at the same time, it's really just kind of a numbers game, right? Because even if you do it on the back end, you're just shrinking the budget. But then, towards the end of the year, when people are looking for, extra budget, or they're trying to make, a move, those dollars might still be there. You're just kind of controlling the point at which you approve it in a different way. Right. And so, yeah, it's really kind of interesting, Brian. Anything else you guys want to add to this conversation in terms of like challenges or discussions that you've been hearing, from your colleagues out there?
I think the biggest thing for me is just the difficulty of qualifying price increases. Again, especially at a single facility where we don't have a solid corporate structure to kind of help with that. And so when a vendor comes to you and says, "Hey, we need to increase prices because of whatever it might be," it's very difficult to validate that. And again, the same thing with tariffs. And again, I'm not casting stones at our vendor partners. We need them, right? They supply services, supplies, equipment, everything that we need. But again, remember, they're in it to make money as well. And so if they say, hey, we've got to increase this price because of tariffs, it's very difficult. They can, if depending on the contract, like we talked about, easily just escalate pricing. And to Suzi's point, we're stuck in our contracting. We can't go out and start charging patients more or the health plans more. And so it is a very difficult balancing act. And I sometimes think that suppliers and vendors forget that. Again, they think that hospitals have just this huge surplus of money. Again, it depends on the type of organization that you are. But again, it is a already very strained financial environment from the hospital healthcare perspective.
And it's interesting. I was having a discussion with my 85-year-old uncle, and he's like, well, is it really going to hurt you? And I was like, yes. So I literally used my chicken wing example. If you guys remember, and I think it was 20 or 21, when for whatever reason, the price of chicken wings went extremely high, and all of a sudden restaurants were charging 2 and 3 times the cost. We don't have that luxury. So I think that's where it just gets to be very unnerving in this time to understand, because unless they're going to match it with increased, Medicare reimbursement, hospitals will struggle.
Yeah. Yeah. It sounds to me too like from this conversation, you're really relying a lot on your GPO partners to help you navigate this, through giving you insights and education to evaluating contractual impact and trying to help you, defend rising costs from happening, kind of abruptly and without the ability to properly plan. I think is something that, I'm hearing loud and clear here. um, I guess we'll see how it plays out. It has been definitely challenging times. Brian and Susie, I appreciate your insights and just kind of sharing what your conversations have been like lately, because obviously there's no perfect answer to how to manage this today. And have to just give some credit again to the AHA for advocating for the healthcare supply chain, and the potential impact of this. So hopefully no trade wars, Brian.
Right.
Obviously, that's a major, major concern, and it's kind of a dirty word right now. So fingers crossed. Hopefully, we'll by the time this airs, things will be improving, and we'll have a better handle on them. So more to come on that. This has been another Power Supply video series. Justin Poulin here with Brian and Susie. Thank you so much for watching.